Hey friends, welcome back to my channel. Myself Dr. Hilary. I'm currently pursuing my masters in prosthetic dentistry, Crown and Bridge, and also trying to provide valuable and informative content through my videos on this YouTube channel. So if you are new to the channel, please consider subscribing it. So guys, in today's video, we are going to discuss about MBA as a career option after BDS. And first of all, I don't want to provide you the information which you have already read, heard or watched in any other YouTube video, okay? I want you to, experience how that field is actually, and also provide you the information which is required right from the eligibility, fee structure, salaries, opportunities, okay? So I have covered all these things into this single video. My sincere thanks to Dr. Kanchan for being so much transparent and sharing all the information in such a simplified manner. So Dr. Kanchan is currently a quality assurance manager in healthcare industry, and she's a very good friend of mine. So let's welcome Dr. Kanchan and start this conversation. For your simplicity, I have also provided timestamps. If you just want to watch a particular part of this video, you can. And if you value my and Dr. Kanchan's effort, please don't forget to hit the like button, share it with your friends, and if you still have any queries, questions or confusions, you can drop a comment below. We are very active and will try to reply to your comment as soon as possible. So now, any further ado, let's get started. Hello, Dr. Kanchan. Welcome to my channel.
Hi, Hilary. How are you?
I'm good. How are you doing?
I'm doing good. Perfectly fine.
Okay. So why you did MBA after BDS?
So during my internship, when we, do the rotatory internship in BDS. So I was looking for options I can get after BDS. One of them was MDS, as we all know. But my whole idea was that I didn't want to, to go through that phase again, which goes with NEET and then, prepare so much and give so much efforts and then do a 3-year MDS course. And then also we are mostly clueless, like what after MDS. So I want to have a stable future where I will know, that I have to do a particular type of work where a future is promising, So I looked for options and I wasn't much satisfied with the clinical practice that we used to have. So I was quite saturated with dentistry. So when I was researching for options, I landed upon this option, that is MBA in health and hospital management. So it was a lengthy process of research, and I looked into MPH also. I looked into normal executive MBA courses, but then I wanted to also, be in touch with the health field that I was in. So that's how I landed upon, I finally decided that MBA is a suitable option for now.
Okay. So what is the course duration?
So the post-graduation duration is of 2 years.
Okay.
Be it any course, whichever you select, be it MHA, MBA or MPH, all of the courses are 2-year courses.
Okay. And what are the eligibility criteria for the same? Do you have any entrance exam, or on what basis do they select you?
See, there is a whole process that you have to go through. You first have to look for colleges, which colleges provide these type of courses, which are the universities which are giving a full-time degree course to you if you are wishing to have a degree course. Then what the process involves is an exam, which you have to clear. It's mostly an entrance exam, a general entrance exam, which is CAT, MAT or CMAT. You have heard about. Most MBA colleges consider that exam.
Right.
Then you go through a group discussion round, and then you go through a personal interview.
Okay.
These are the 3 steps you go through.
Okay.
So what happens is most of the colleges or universities accept CAT, MAT or CMAT score, but there are also universities which have their own exam.
Okay.
IHMR has its own IHMR MAT. TIS has its own TISnet. So that's how it goes. They also accept CAT scores. They also conduct their own examination. So whichever way you feel that you can crack the exam, you can go for it.
Okay. And what about the fee structure?
See, it depends on the college completely. If you are doing a proper MBA, then the fee will be a little higher.
Okay.
But at an average, you like the fee starts with 4 or 5 lakhs around, and it
Per
goes,
year.
yeah,
Okay.
it goes till 8 to 10 lakhs. That is the highest you can go for
Okay.
2.
Okay. Okay. And can you name some of the reputed colleges which students should approach?
See, the best college, if we speak about MBA kind of course,
Hmm.
so people mostly prefer TIS, that is Tata Institute of Social Science. So it offers a healthcare and hospital management course.
Okay.
Then people also consider IHMR on their second list. It's called Indian Institute of Health Management and Research. It offers a course named MBA in Hospital and Healthcare Management.
Okay.
So if you want to go into MBA field, then these are the two top colleges which you
Hmm.
can opt for. And all of these colleges take their own examinations if you don't want to appear for, CAT, MAT, and CMAT, because that the level of CAT is a little higher than what we require. We
Right.
going into, proper executive MBA, so we don't require that much amount of aptitude to be into. We can go with the university exam. So these are the two
Okay.
colleges which provide this course. If you want to go for MPH, then there are different other colleges which are more related to public health.
Okay.
Yeah.
So, what is your curriculum throughout these 2 years?
See, you are taught everything with what comes into MBA. So what my college offered was the first year of your course is a basic MBA course. Like
Okay.
you study principles of management, you study human resource management, you study finance, you study accounting, you study everything that an MBA graduate must know. And
Okay.
then it also includes a fewer subjects of your health and hospital basics.
Okay.
We study health development. We study about health programs that are going on in India. We study about hospital services, what type of services a hospital are giving these days. So these are the
Okay.
basic study in first year. Then in second year, you go for a particular specialization. You either select hospital management, you either select healthcare management.
Okay.
So hospital management have different set of subjects and curriculum, and healthcare management has different set of subjects and curriculum.
Okay.
Yeah.
So, how you found this? Like, was it difficult for you to study all these new subjects, or it was just it went smooth?
See, I personally speaking, I was since the beginning, since my school days, I was good with aptitude and maths and everything. So I didn't have that much of a problem studying these subjects. But
Okay.
you also study a lot about healthcare that is going on in India. There are so many things that the government is doing, that the non-profit organizations are doing in health field that we don't know about when we are in BDS.
Hmm.
Like I got to know a lot about the current scenario of our country.
Okay.
So it's not difficult. I won't say it's difficult, but it needs your interest. It needs is your interest.
Right.
If you like what you are studying, like those health, if you like knowing about those healthcare programs that are going on and what the government is doing, then it's pretty easy. Yeah.
Okay. Okay. So, what are the opportunities once you are done with your degree?
See, as I said, there are two fields. One is of hospital management,
Right.
one is of healthcare management. In hospital management, you get to work in hospital administration area.
Okay.
So hospital administration area has see, when you go to a hospital, we all have been to a hospital, right? So you see all the services that a hospital is capable of providing in this date, in this century. So all the administration part of the hospital is the core backend work that provides, the functioning of the hospital. So you get to work in that area. If you go with healthcare management, you get to work in public health programs. Like I said, the government and the non-profit organizations are doing a lot, to strengthen our healthcare system. As we saw in this pandemic, our healthcare system is not up top notch, but we are working on it, right? So are many things going on. If I'll start, it's not gonna end here.
Right.
So it depends on your interest in which field. You both are a little different fields, which you can. But it totally depends on your interest where you want to work. You want to work in public health. You want to be in that domain, or you want to stick to hospitals. So
Okay.
these are the two options. The other options that are there are healthcare consulting. There are many consulting firms that provide quality consultation to the hospitals or these organizations that are working in healthcare. So
Okay.
there is this healthcare consulting. You can go into that. There is also a fourth option called healthcare IT. So
Okay.
you can work in the information technology part of the healthcare, that supports the whole data and system that we have that runs the healthcare in these time.
Okay. Okay. So opportunities are many, right?
Many. See, that also depends. If you what course you go into.
Hmm.
MBA in healthcare and hospital management in a whole is a degree that gives you all these options. That gives you a wide scope of options that you can go into whatever field you wish to.
Hmm.
But if you select MHA,
Hmm.
MHA is a specifically Masters of Hospital Administration that only gives you an option of going into hospital administration or consultation area. It
Hmm.
doesn't let you work in public health.
Hmm.
When you go select for healthcare management MPH course, you
Hmm.
preferably work into public health and not in hospitals.
Hmm. Hmm. Right. Right.
So,
So how is the hiring process for the same? Like companies approach you, it is through campus, or you have to search for a job after once you get the degree?
no, see, most of the colleges that are providing this course have their placement cell.
Okay.
So get a lot of opportunities in when you are in your post graduation already. So there are many organizations that are tied up with the colleges and university that provide such courses. And then there is a placement process which also you undergo with interview and group discussions. And every organization has their own way of hiring, their own hiring process. So you undergo that and you get placed, and it's a good way to start, I would say.
Okay. Okay. So getting a job after doing MBA is difficult, or it's easy, or you still have to struggle? How is it?
See,
Like, is there saturation like dentistry?
See, I would not say that it's easy. The best way you can, like what I have experienced till now, is the best way to kickstart your career is, getting a placement through the placement process,
Okay.
because you get good packages if you are placed from the college. You are you're considered, you are a fresher when you are recently passed out, right? You don't
Right.
have much of the experience into this field. So the organization that is hiring you knows that they are hiring you from a college campus. Then they know that you are a fresher and you must or must not know everything, so they
Hmm.
train you accordingly.
Right.
If But the issue here is, if you are looking for a job on your own after this course, freshers don't have much exposure or opportunities to get into. Most of the organizations that have vacancies for you demand a minimum of 2 years experience.
Okay.
Yeah. So if you are looking for a job on your own, you don't start off with a good package. You start off with a normal 25,000 per month sort of package if you are
Okay.
looking at your own. But if you
Okay.
are getting a placement which is offering you a good package, then I would say go for it.
Okay. So what is the salary package? Any range which you can give?
See, depends on the organization, definitely. But if we talk about range, it starts from around 4 lakh per annum
Right.
to 10 lakh per annum. Yeah, this is
Okay.
the range. And
Okay.
at an average, if you are even an average student and if you have a skill set, you can easily grab a 5-6 lakh package per annum. Yeah.
Right. Okay. Okay. And what is the designation which you get as a fresher?
See, you get a designation of management trainee
Okay.
for the start as a fresher, and
Hmm.
then there are probation clause in every organization. You get a 3 month or 6 month probation period, post which you get your permanent employment, and your package might increase.
Okay. Okay.
That
Right.
depends on your performance. That varies from organization to organization.
Okay. Okay. Right. Now tell us something about your work life, work environment, what kind of work you are doing.
Okay, so I got placed into an healthcare IT organization.
Okay.
So when the placement process was going, this was the first organization that I had applied for, and I got selected into that. And then I was working. I was I was more of a public health person. I still am, but then I was placed into a healthcare IT organization, which is like a corporate field of work. It's a corporate life. You are living a completely different life when you are in a corporate field or
Right.
office, right?
Right.
So the organizations are really nice, I would say. They have a very cool culture of work. They have, you work a lot, you learn a lot. MBA of 2 years teaches you a lot, but when you step into the real field, when you start working, it is a totally different life.
Right.
So, but the perks of working in a corporate office, I would say, is you have a really quality lifestyle.
Okay.
You get a lot of exposure. You get to meet a lot of people.
Hmm.
You get your Saturdays, Sundays off. You can
Right.
have a good lifestyle if you want to,
Right.
pursue that.
Right.
And working is like it any day depends on you. If you are into a field that is your core, like some people are core hospital people, they want to work in hospital administration. Some people are core public health people, they would love to work in a rural area and strengthen our healthcare system. And then some people are core corporate people who want to work in an IT or consulting firm.
Right.
So that depends. If you are at your right place, you will enjoy working. It's not that difficult. It's all that there are amazing people out there who guide you all your way through. If because they, as I said, they know you are a fresher and they train you according to their organization's needs. So that is the best thing I would say.
Right. 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 Any
Yeah.
downside of this corporate life which you would like to mention?
See, again, depends on the organization you are working for. Some organizations take a lot from you and don't provide that sort of culture of work, that
Right.
ease of work. The organization I was hired into, I was placed into, has its complete clientele of US. It works for US healthcare system. So they were pretty cool people. They are very chilled out people. They are not much like you have to do this. They are not like deadline people. They
Mhm.
enjoy work and then they make you enjoy work. So I
Right.
would completely say it depends on the organization you are into.
Okay. Okay. So
So
one last question.
different in different organizations.
True. True.
Yeah.
So one last question, that a person who has done this course here in India and is looking for opportunity in abroad after
Yeah.
completing this course.
Yeah.
So can you name any?
See, during our placements, there were hospitals that came from Abu Dhabi,
Okay.
Dubai, Muscat. So Middle East countries have a lot of options for you. And
Right.
then if you want to go to like countries like US, Australia, and these places, I would say you might need a little bit of experience then on there also. Healthcare IT, I would say, is a field which has its opportunities all over the world. Like the organization I was placed in, as I said, has its whole clientele of US. So it has its office in San Francisco. So you get opportunities from the organization itself. But when you are applying it on your own, you will need a minimum of 2-3 years experience into the field.
Okay. Right. Now, any last message which you would like to give to my audience?
So I would just say if BDS is not your place, I would say this is an amazing field to work into, but you must know where your interests lie. As I said, if you are a core public health person, I would say research, go to the Google, put whatever you want to put and research what you will like. If you are a core public health person, I would say go for MPH. Don't go for MBA in hospital and healthcare, because a BDS plus MPH or an MBBS plus MPH uh, is like the most demanding person in public health industry.
Right.
So if you are a core public health person, go with MPH. If you are a core hospital person, go with MHA. But if you want to experiment in different fields, then go with MBA. That is
Right.
the most clarity I can give.
So the basic thing is the viewer has to figure out that where their interest lies and
Exactly.
then move forward. Right.
Exactly. So I would say if you are opting for a degree course, you are putting so much money and your time and your efforts, then look for it very well. You should R&D it very well and know where your interest lies.
Right. Right.
And one more thing I would like to say is when we are in BDS, we don't take MPH very seriously. We don't take community dentistry very seriously. But I would say what you learn in your BDS in the course of public health is a very principal part of it. There is
Right.
much more to it, and you will eventually like that field.
Right. So thank you so much, Kanchan, for
Thank
putting
you,
this
Ravi. Thanks for having
into
me.
very simplified manner. It was actually very, simple and easy to understand the way you described the whole process, your experience. Even I enjoyed it.
Thanks. Yeah. It was lovely seeing you after so long. Thanks for
Same,
calling me.
same here, same here.